Right, well, this is the first slide, small
Yes.
mammal exotics, rehab, tips and pearls. So I'm just gonna slide through these quickly so that you get to see them, the outline. Um, and then we just started to dive into the different types of patients that we see, the challenges in treating these patients, pain medications. We don't have a lot of information on the bioavailability, safety, efficacy studies are missing, and administration can also be quite challenging. Okay, so then the question I have for you guys here, this is going to be audience participation. I want you guys to tell me how many of you are currently using the Assisi loop on these various species, and you can choose as many as you like. So are you using it in rabbits, birds, reptiles, or other small mammals? So on this next screen, I want you to scan this QR code, and that's going to open it up to this survey. And then you can go ahead and answer, are you currently using the Assisi loop on rabbits, birds, reptiles, other small mammals? And if you're not using it, then you don't need to answer, but go ahead and put in there if you are using it and which ones. Okay, awesome. So it looks like somebody's answered. Nice. Yes, I'm just going to leave this open until more of you participate and we can see your answers live on the screen here. So it looks like very few of you are using it in reptiles. And it looks like for those of you that are currently using the Assisi loop, it looks like you're all using it currently on rabbits, birds, and other small mammals. I don't know if there's anybody else that hasn't participated, but I'll just give you a couple more minutes. Okay, nice. So yeah, this seems about right. Yeah, so most of the time I find that for those who are using the Assisi loop, and of course many people aren't, we're mostly using it on the small mammals, so like your chinchillas, your guinea pigs, ferrets and rabbits, and to a lesser degree birds, and then the smallest percentage is reptiles. Okay, cool. All right, well I'm going to move on to the next slide. Definitely some issues here on the sharing. And so I just wanted to introduce you to PMF, what it's all about, and how it might work in our species. So, a little bit of background on these therapies. It's important, I think, to understand how electromagnetic fields are used naturally in bodily function. So, all atoms and cells, like right now in our bodies, they produce electromagnetic fields. And these electromagnetic fields are actually quite unique to the specific organ system. So each organ produces its own unique bioelectromagnetic field. And cells are communicating in this way every single second right now. Like 70 plus trillion cells in your body right now are communicating via bioelectromagnetic fields.
Okay.
And so it's no,
I'm
oh,
so sorry. We're still looking at the QR code screen. I don't know
oh
if
my
the share
God, that's
screen
so
is,
weird.
yeah, it's acting a
Okay.
little.
Did it go back?
So we're still seeing the QR, the
The
survey.
QR code.
Yeah,
Okay. And so you're not seeing these slides right now.
we're not. No.
Oh my gosh. Okay. All right. Well, I'm going to share again. I don't know what's going on. It might have to do with the Slido that is
Okay.
just kind of taking over. So I'm going to reshare and then hopefully you seeing, do you see the background now? It should say background and it has like a purple.
Yes, I sure do.
Yeah. Okay. Awesome.
Sorry about that.
Yeah. Sorry, guys. It must have to do with the when you do the surveys, sometimes it can take over your computer screen. Okay, so as a background, all cells and atoms communicate using electromagnetic fields, and there's unique bioelectromagnetic fields for each organ system. And literally every cell in your body, trillions of cells every day, every second, are communicating using changes in electromagnetic fields. So it's no surprise that therapies that can influence bioelectromagnetic fields actually can have a big impact on functionality of cellular communications. Tissues are very, very sensitive to changes in electromagnetic field activity. Did you see this new slide? It says PMF mode of action.
Yes, we do see that.
Yay. Okay, good. Well, just keep telling me if anything. I think I do have another Slido one, so we might have an issue there, but
Okay.
um, excellent. So on the mode of action, I think it's important to understand this because then it allows us to understand that this is effective therapy. And so what happens when you use the Assisi loop is it has actually a change in the binding of calcium to calmodulin, which is a voltage dependent process, therefore influenced by bioelectromagnetic fields. And what happens is with that upregulation of binding of calcium to calmodulin is we get induction of constitutive nitric oxide synthase, which is the good kind of nitrous oxide synthase, because you guys may have heard about nitrous oxide causing inflammatory changes, and that's the inducible nitrous oxide, but the constitutive actually has anti-inflammatory effects. And so when we get this upregulation of calcium to calmodulin binding, that stimulates the constitutive nitrous oxide synthase, producing nitrous oxide, leading like rapidly, like within seconds, you get vasodilation of the area that you're treating. And when we have this binding, it also actually stimulates cyclic GMP, which leads to an anti-inflammatory response where you get decreased IL-1 beta. That's one of the most inflammatory cytokines, particularly actually associated with OA, but many other inflammatory processes. A decrease in that inducible nitric oxide synthase, and you get an increase in your growth factors like VEGF and increase in angiogenesis, so more blood flow coming into the area. So overall, what the effect is with this bioelectromagnetic field that you are putting on the surface of the body, that actually upregulates the voltage dependent binding of calcium to calmodulin, which leads to a cascade of anti-inflammatory cytokines, which ultimately lead to improved tissue regeneration and remodeling. So that is how it works, which is pretty cool. And this technology actually has been around for over a century, but it has changed and modified over time. And so initially, the original electromagnetic field devices actually generated heat. So back before the 1930s, there were these diathermy machines. They were basically radio frequency devices that were causing heat in order to cause this change in electromagnetic fields. And in the 1930s, the modernization was they adapted these machines to not produce heat. And that was essentially a change in the frequency and pulse width of these devices. And then in the 1980s, we see these bone growth stimulators, which are still pulsed electromagnetic field devices, but they were specifically designed as low powered PMF devices, again, non heating, that had an effect to improve bone growth. And these were actually approved in the 1980s by the FDA for human use. In fact, based on some canine studies where they showed in beagles that there was improved fracture healing. And then in the 1990s, we see the latest generation, which is what we're using now, of these PMF devices, which become now smaller and more targeted devices, which can be easily used to treat soft tissue injuries, particularly because we know these devices actually can penetrate soft tissue bandages. And then the other therapy that I wanted to talk about today is extracorporeal shockwave therapy. This is also technology that has been around for decades. It was originally designed actually for lithotripsy. So when there were calcium calculi, you administered shockwave therapy to break up the stones into small pieces, and then the stone would pass. It has since then also been modified in order to provide therapy for soft tissue injuries. This is a sound-based energy, and what happens is it delivers a very high pressure, high velocity, but very low frequency sound wave energy, which leads to very massive changes in cellular mediation, which is essentially you get a cavitation. So when all of this sound comes in, this rapid high velocity sound comes into the tissue, it almost forms like a little bubble that cavitates. And during the cavitation process, you get massive increase in blood flow and also very significant release of anti-inflammatory cytokines, which again really help to promote tissue healing. We have some nice studies on the veterinary field for electrohydraulic machines. There are different kinds of extracorporeal shockwave therapy, and a lot of people don't realize that people hear shockwave therapy and they think it's all the same. It's actually a lot of different machines out there. So the main three different, well, there's two essential categories, which is focused shockwave and unfocused shockwave. Unfocused is like radial shockwave, which some people argue isn't even shockwave. But then within focused shockwave, we have electrohydraulic, electromagnetic, and piezoelectric. So the main two machines that you'll be seeing sold in the United States are the piezoelectric and the electrohydraulic machines. Well, if you look in the literature and the evidence, practically 99% of the evidence in veterinary medicine is for the electrohydraulic machine. There was one recent paper published on piezoelectric, which was a retrospective study for shoulder tendinopathies in dogs, but we have no prospective evidence on piezoelectric at all. And we have dozens of published studies, both in horses and dogs, using the electrohydraulic machine in veterinary medicine. And what's really cool is, yeah, so a couple of the papers that I reference because we use shockwave for OA is we shown efficacy for treating stifle OA and elbow OA in dogs. We also have a couple papers demonstrating improved bone healing for dogs recovering from post-op TPO. We also have a couple papers demonstrating efficacy of shockwave therapy for treating shoulder tendinopathies in dogs, so for soft tissue injuries. So those are kind of the major, and also for wound healing. So OA, bone healing, shoulder tendinopathies, soft tissue injuries, and wound healing. We have really nice evidence for all of that with shockwave. And then the really nice new advance of this machine is that there is a new X-trode. So the trode is what you can see in the picture here. It's basically the handheld device that delivers the sound wave energy and then it goes into the tissue. So it's non-invasive. You don't cut tissue. We do recommend shaving so you get better penetration of the sound waves, but otherwise it's a completely non-invasive treatment. We used to need to sedate patients because it can be a little bit uncomfortable, but there's a new X-trode which does not require sedation, and there's actually a nice publication out of CSU demonstrating that the X-trode is in fact better tolerated than the previous trodes that required sedation. So that has been a really new advent of this machine, is that you can administer it without sedation with good efficacy. And so I just wanted to show you a case example of a duck that we treated that had a really, really nasty fracture in its metacarpal and developed a nasty wound there as well. So this duck was actually non-weight bearing on the foot, and you can see it was almost flaccid and was non-weight bearing on that leg. And so one of the things that we really wanted to do was improve bone healing, because this was essentially became a non-healing fracture. We did both a CC loop, which was done in clinic, but also the owners were administering this at home. And then we also did extracorporeal shockwave therapy. People don't often think about using extracorporeal shockwave therapy in exotics, but you can see here, and let me see if you can hear, play that.
Very, very
I
faint.
don't know if you could hear some of that. I tried to put my headset there so you could hear it, but it does make a sound. It's very well tolerated, though, and we administered the shockwave directly to where this fracture and wound were in this duck. And then we did do serial bandage changes, and again, we were doing the CC loop at home and in clinic, and look at the tremendous difference. So this was actually after 3 weeks of therapy. So we did the shockwave therapy. We waited 2 weeks. We repeated the shockwave, and we were doing daily a CC loop at home. And this is a nice video of him in rehab. We were doing some swim therapy, which he was delighted with. And then he had actually complete recovery. So that was really nice because for many months they had been treating this duck that was essentially just continuing to get worse. So yeah, we talked about briefly the effects on wound healing on shockwave therapy. Let's talk about the effects of PMF on wound healing. So we know that the loop targets anti-inflammatory nitrous oxide signaling by producing anti-inflammatory cytokines and reducing the pro-inflammatory cytokines. It also actually upregulates the release of growth factors. So these are all, of course, really good for wound healing. So here you can see a guinea pig with colitis, so really nasty fungal infection. And then we looped it, and then this is what it looked like after a few weeks of doing daily a CC loop treatment. Very easy to administer. It's non-invasive, very well tolerated. Here you can see the effects on reducing soft tissue swelling and edema. So this was a pig that was attacked by 2 dogs. Actually, it was really sad. It had a lot of erythema and swelling around the neck. And after this is actually after 1 week, so it's just the first week of doing daily a CC loop treatment, and you can see how nicely that inflammation came down. The tissue's healing really nicely, and of course very well tolerated because it's a non-invasive treatment. He basically, just wore it like a necklace and was very very, very well tolerated. Oh, I just love that face. Um, and a big thing that I wanted to mention about PMF devices is that they're not all the same. Just like we were talking about with the shockwave machines, they're not all the same. Same with the PMF devices. These devices became FDA cleared for the treatment of soft tissue swelling and edema anywhere in the body on the human side. And that FDA clearance came at a particular frequency, which is 27.12 megahertz. So at that wave frequency, we have the FDA clearance. And so for all of the devices that are out there that have that FDA clearance, that is the frequency that they're going to deliver. But the technology is different in many other aspects of the therapy they deliver, including the wave pulse width and the pulse frequency that's delivered, also the size and the geometry of the antenna that's delivering the PMF therapy, also the duration that's required for the patient to be treated. And here's just a nice example. This was published by Gaynor and Vet Research 2018. Where basically he compares the difference between a non-targeted PMF device and a targeted PMF device, where the non-targeted is delivering, again, that same FDA cleared frequency of the 27.1 megahertz, but then we have a change in the pulse width. And then in particular, you'll notice that the pulse frequency, it's a much higher frequency in the non-targeted device compared to the targeted PMF device, which was just 2 hertz pulse frequency. The non-targeted device, they were administering treatment for 12 hours a day. That's a lot of time compared to just 15 minutes twice daily for the targeted PMF device. And then what they did was measure VAS scores. So these are visual analog scores for pain. And this was for patients experiencing knee osteoarthritis. And what you see is that despite the much higher frequency delivered and much longer duration for the non-targeted device, we actually see a much more significant decrease in pain scores in the targeted PMF device. So you see the VAS scores were reduced by 38% in the targeted PMF devices and only a 25% reduction in the non-targeted devices. So again, they're not equal. You really need to look at the data for the companies that have these devices because they are not all the same. And I just wanted to review some of the cases that we have treated in our exotics department here. This is actually a chameleon that was just post-op ovariohysterectomy, and we did the PMF device. We found that we didn't need to administer as much of the pain medication, which was really nice. And here you see that we have a bird that actually had a fracture fixation, and we did the PMF device as the bird was recovering. This is a rabbit that had some oral extractions and was in a lot of oral pain that we administered the loop on. Here you can see a chinchilla. This was actually a chinchilla that was having chronic oral pain. So we did some acupuncture as well as the loop. And you can see here it's very targeted. So if you can make the loop be as close to the area that you're treating, so you don't want to use a larger size than necessary. So if you can use a smaller one for a smaller area, that is recommended. The more targeted, the better. This is a rabbit post-dental. We love it post-dentals. It seems to really make a difference for reducing that soft tissue swelling and edema. And you can see the bunny tolerates it very well. This is another bunny with oral pain that we were using. And then the owner actually was taking this home as well. And then interestingly, we've had some, I can't say it's 100% success, but for some of our really difficult to treat cases with feather picking, we have found that the PMF loop can be really helpful. So it can reduce some anxiety. And really, I think what it's probably modulating is pain, because a lot of the reasons why they're pulling that, it's almost like a self-induced, it's almost like cutting in people, where I think that pulling of the feather, it gives them some type of a pleasure there. And the PMF device, because it does lead to an endorphin release and reduction in pain, it can really help to modify some of the feather pickers. We've also used it a lot for both rabbits and guinea pigs experiencing GI stasis. It can be really helpful. And then we've seen a couple of macaws post-stroke. So this was a macaw that had a stroke, was completely paralyzed, had no ability to ambulate at all. And then we started treating in hospital, both with acupuncture and the Assisi loop and some rehab exercises. You can see here's 2 days later. And we were working on actually improving head control. And you can see very nice improvement here. So what was so nice about the treatments that we did, again, is they're all non-invasive and can really make a huge difference. I don't have a video on that macaw, but one of the things that I do like to do post-stroke is passive range of motion. So I just want to show you this video um, in different species here, but range of motion. So you want to try to get them to grip your finger, and then you very passively do extension and flexion. None of the movement should be forced. It's very um, patient dependent what they will tolerate, but we're really just trying to get flexion and extension. This particular bird actually had hip OA, and so I'm doing some circular range of motion of the hip joint there, which you can see was very well tolerated. So you can do medial lateral motions, you can do sagittal, which is flexion extension, and you can do circumferential, which are all very nice. I'll just play that again. Um, so this pigeon actually came to me obese, was very symptomatic for that hip OA. And so we actually did a diet and some flight therapy for cardiovascular workout. But then these exercises mom was doing at home with that passive range of motion. So I'm not pulling on the leg. So she's actually gripping on her own voluntarily, and we're just trying to get that range of motion in a variety of different planes so that you can really improve that joint fluid production and joint health. Okay. And then as far as reducing pain, we actually have probably the most robust data for PMF in pain reduction. So the original studies were actually done in women that were recovering from breast surgery. Many of them are actually from mastectomies due to cancer, but they've actually studied it also with like breast reduction surgeries, for example. But what you can see here is in these women that had had mastectomies, pain reduction was reduced by threefold, so 3 times faster in the PMF group compared to the sham control device. And then they measured the inflammatory cytokines. Remember, we had talked about IL-1 beta. So this is one of the most inflammatory cytokines. And at the site of the wound, they found a 40% reduction in IL-1 beta. So that is very, very significant reduction. And then really interesting finding that we actually replicated in a canine study is that so these women that had had breast reconstruction surgery, the women that had had the PMF device compared to the sham device, their use of narcotics postoperatively was reduced by 50%. So if you got the PMF device, you were likely to reduce the narcotic use by 50% compared to the sham device, which was not providing PMF treatment. So remember that number because it's really interesting. We see this similar findings in the veterinary ones. Okay, so here we're coming up to our next question that I have for you. So, for those of you that are treating reptiles, which NSAID is most effective for treating reptiles? Is it a COX-1 inhibitor like aspirin, so more COX-1 selective, or is it better to use a more COX-2 selective inhibitor like meloxicam, or do you want to use something that's a combination of both COX-1 and COX-2 inhibition like topoxylin, or do we just not know in reptiles? So here, oh, hold on. See now, all right. I'm just gonna have you guys. I don't know if you can try to scan the code. It should still work for you. Um, I don't know if one of you guys had already answered in there, but go ahead and scan the QR code and see if you can answer the question. It looks like it may have had the previous answers in there, but see if you can answer that. Yeah, it is. Okay, good. Thanks, you guys. Yeah, so is it best for reptiles to use a COX-1 selective inhibitor? Is it best to use a COX-2 selective inhibitor or a combination of both COX-1 or COX-2, or do we just not know? So I'm just going to give you guys a moment to scan that QR code, get a few more of you to answer here and see what you think. So it looks like most of you are answering that either we just don't know or it's better to use a COX-1 selective in reptiles, whereas in small mammals, we're definitely reaching for the more COX-2 inhibition. Just going to wait a couple more minutes. If you haven't had a chance to scan that QR code, it should take you directly to the question. Okay. So looks like a very few minority of you think that COX-2 is better. Majority of you are saying that it's unknown or COX-1. So, okay, awesome. All right. So I might have to reshare my screen there because this is where it seems to get caught up. So you guys just tell me. I'm going to try to move the slide.
Looks good.
Yeah, you can see it. Does it say reptile pain?
It does, yes.
Yay! Oh, so it worked. So happy. Okay, fantastic. So here's what we know about reptile pain, is that it really depends on the species. And reptiles are kind of all over the place. It's kind of crazy. But so in pythons, they found that after tissues were traumatized, essentially, so pythons with traumatized tissue, they primarily express COX-1. So for pythons, a COX-1 selective inhibitor is best. However, in turtles that had traumatized tissue, they found that both COX-1 and COX-2 were elevated. And so in a turtle, these were box turtles, a combination of COX-1 and COX-2 would be better. But in the inflamed muscle, so if you're looking at muscle as opposed to the surface tissue, it was primarily COX-1 inhibition. And so really my bottom line here is there's a lot more we need to learn about pain management in reptiles, because what we do know for sure is that these mechanisms, particularly the arachidonic acid cascade mechanisms, are very different in reptiles than they are in our small mammals, and even from birds. So the traditional NSAIDs that we tend to do more COX-2 selection for small mammals may not be as effective for reptiles. So you guys answered perfectly. We really don't know, but we tend to err more on COX-1 selectivity because that does seem to be more effective, at least for the few studies that we have on reptiles. So what's cool about the PMF device, because these are bioelectromagnetic fields, we expect it to work quite well actually in a reptile. So this was a python that we were treating with a chronic wound, and you can see very easy to administer. You just put the loop directly over them. They tolerate it very, very well. So I wanted to just provide you a little bit of the background evidence that we do have published in veterinary medicine. Sadly, this is not in exotics, but it's relevant because I conducted the study here at the Animal Medical Center, and it was a relatively large study for veterinary standards. So what we did, it was a prospective, double-blind, randomized, placebo-controlled clinical trial. We recruited 60 dogs, but 53 actually completed the trial. So there were 53 client-owned dogs. These were dogs that presented for hemilaminectomy. 27 of the dogs received the targeted PMF therapy, and the other 28 received a sham therapy. The devices looked exactly the same. They had a double blinking green light, so owners couldn't tell the difference between an actual PMF device and one that was the control. And these patients were, of course, randomized and they were blinded. We were looking to evaluate postoperative pain, wound healing, and functional outcomes in dogs following their recovery of hemilaminectomy, whether they were receiving the PMF or the sham control device. These results were published in JAHA in 2019, so that's the reference there for that. If you want the paper, let me know. I'm happy to send it to you. And so let me just review some of the results of that study. Before that, just tell you about the device. So the Assisi loop itself, again, it is a targeted pulsed electromagnetic field device. It is battery operated and portable. It delivers therapy actually to a wider range than we used to think. So about 20 centimeters, so about 7.5 inches on either side of the loop, it will deliver therapy. So this is why it does go through bandages. And if your patient is small enough, I recommend looping it through the entire body. So in a dachshund, we actually put it on almost like a hula hoop so that it would treat the entire spine. But if you have a bird, you can just loop it through the body of the bird, or like you have oral pain, you can just set it over the face, or like you saw in the pig, we wear it like a necklace because it's going to go up and down both directions. What it doesn't do is go outside of the circumference of the loop. So it goes through the center of it in both directions for 20 centimeters. It will penetrate soft bandages, wraps, blankets, pads, all of that. It will go through no problem. So as far as the results of the study that we did here at the AMC, we did find that wound scores improved at the 6-week mark postoperatively. We also found from surveying the owners that they said that the CC loop was very easy to administer. We had no significant side effects noted from the treatment. And then probably the most important finding from the study was that the owners that were administering the PMF device administered significantly fewer oral pain medications postoperatively as compared to the sham device. And this number, going back to the findings from the human studies, was that particularly for the narcotics, so codeine was administered 1.8 times more frequently in the sham group compared to the PMF group, so almost twice as more. And again, this was a blinded study, so they didn't know, but owners got to choose whether they medicated their dog or not. And the ones that were administering the actual PMF, a CC loop, administered the codeine almost twice more frequently when they were using the sham device compared to the treatment device. So this is really, really important finding, and which is why I do reach for a CC loop for the treatment of pain. All right, I wanted to give you some treatment suggestions, some protocols. A lot of this is just based on experience and what we have seen exotic species respond to. So for your postoperative patients, we recommend putting the loop directly over the surgical site. And acutely, if you can administer it every 2 hours for the first 48 hours postoperatively, and then you can drop down to QID treatments for the next 10 to 14 days. So essentially, after your skin closure, you would continue your QID treatments. For chronic inflammation, so chronic postoperative patients, you can begin at QID treatments for 10 days or until you see significant signs of improvement, and then you can taper that down to 1 to 2 treatments daily. For patients with rhinitis or for oral pain or post-dental extraction and things like that, place a loop over the head, either like a necklace or just placing it directly over the head. Treat 4 times daily for the first 2 days or until pain improves and the patient is eating well. And then you don't need to continue it. That really is the goal, is that they're starting to eat again and you visibly can see the inflammation go down in the face. For gastric stasis and inflammation, we recommend placing the loop over the entire caudal abdominal region. And then do that QID again until clinical signs resolve or they're eating well. And then you can continue it twice daily for 3 to 5 days. And maintenance, you could do like once to twice weekly if they're experiencing chronic GI stasis. And yeah, for more mild cases, you could begin twice daily for the first 2 days or until the signs resolve. I do find for some of my gastric stasis cases, particularly the rabbits that tend to have recurrence, that we just do a 1 to 2 weekly treatment maintenance. It seems to really help them. All right. And so, in summary, we know that from the research, particularly both for PMF and shockwave, both of these therapies have the potential to increase both wound healing and bone healing. They decrease soft tissue swelling, edema, and inflammation. And this is non-invasive. In the case of PMF, you can do it over a bandage or anything else that's soft in nature. If they do have a plate, like let's say they've had a fracture fixation, there might be some interference in the signal, but there's no contraindication. It just might not work as well, but it will penetrate through any soft tissue materials. For the shockwave, we do recommend shaving, or in an exotic species, if if there's just like for birds, for example, I just move the hair out of the way and use alcohol in order to get that probe to be able to contact the skin. We also see significant improvement in pain management. That was the most significant finding for the PMF studies. But we also see really direct improvement post shockwave therapy for pain management. You actually get a very massive endorphin release immediately following a shockwave treatment. And then, of course, maybe the biggest really takeaway for our exotic species is that using both PMF and shockwave is a non-pharmacologic way to treat pain, which is so important in our exotic species that are so easily stressed. They come to us at the end stage of disease, and just the handling of them can sometimes lead to a fatal outcome because they're just hanging on by a thin thread. So being able to have these non-invasive therapies that you can administer both in clinic and at home can really make a huge difference in managing their pain in a non-pharmacologic way.